Government is saying today that, everything would have been easier with hindsight, and a lot of the criticism is hindsight. Do you think that is an acceptable explanation?
Well, it's never easy to be in these roles, but I mean, we have done, as the report laid out, pretty badly in the UK, and specifically in the first wave. We were late on testing, we were late on border measures, we were late on actually, locking down once it was widely seeded. That led to a longer lockdown because longer it takes to go up, longer it takes to go down on your epi curve. And so I think there has to be some acknowledgement that mistakes were made, and you have to hold up your hand up and say they were made, and how do we make sure that we give some justice to the families who were affected, the businesses who were affected through a very prolonged lockdown, the kids who were out of school because we had to shut down everything to bring things under NHS capacity, and then, move forward to say we're going to do better next time.
Is there a sense in which some scientists or medical, public health officials rather, epidemiologists, were happy to go along with, or too happy to go along with political decisions?
It's a really tricky one, because what you're taught, like in scientific advice, is you offer options and then you step back and you let politicians decide what they want to do. And they're really difficult decisions, to be honest. I mean, imagine saying we're going to shut down Heathrow at the end of February when, there weren't really widespread transmission yet. But that's when you would have had to shut down a lot of the air traffic to stop the seeding of the virus. Some places did that. Mali shut down before its first cases. It's a different thing if you're Mali or Britain. But I think, the real lesson here is that science has delivered solutions for our major infectious disease challenges. For HIV, we didn't get a vaccine. We have antiretrovirals. For malaria, we now have a vaccine and antimalarials. With this, there were so many vaccine trials. There were hundreds that started, so many therapeutics being trialed, that the countries that said, let's wait if science can find a solution. Those populations, look at East Asia and Australia, New Zealand, they can now vaccinate, they can acquire this Merck antiviral pill. They're going to protect their populations and open up without the loss of life we experienced.
Yeah, I mean, and this, they're talking about groupthink. That, I suppose, arguably could include you. You were advising the Scottish government. What do you think of this, the use of this phrase, groupthink?
Well, I think if we look at the timeline, so SAGE was not transparent at that point who was on it in the minute. So I didn't even know who was on it in March. I only got involved in the media in mid-March when the UK didn't go into lockdown on March 12th. And I was like, okay, something's off, because I had been studying as an international expert what was happening in East Asia. And so I only got involved at the early April. My first meeting was April 2nd on the Scottish Advisory Group meeting. And actually, I give respect to the Scottish government for taking one of the harshest critics of the early response in March, as I was outspoken, and saying, okay, if you think you know what you're doing, then come help us and tell us what we should be doing. And at that point, we tried to get testing up and going. We tried to get isolation policies. We tried to hold lockdown longer in the summer to get the numbers lower. We tried to bring in border policies. We tried to get those things in place, but obviously it couldn't undo what had happened in March and April.
Okay, Professor Sridhar, thanks very much for your time. Thank you.